Good evening, everyone, and welcome to M.E.R's webinar titled Fields of Pharmacy, a quick dive into different specialties of pharmacy and celebrating American Pharmacists Month. My name is Carissa, PharmD candidate at Roseman University, class of 2022, and also your event coordinator for today. Thank you all for taking the time out of your busy schedule and attending tonight's event, and I hope you're all doing well and staying healthy. Please keep your audio muted and reserve your questions at the end. I'd like to first go over our agenda for today. We'll start off with some introduction of our panelists in our university. Then we will begin our presentation shortly with the community pharmacy, specifically retail. We'll go into clinical with ambulatory, and finally with institutional. Lastly, we will finish off the event with a panel discussion where you'll have the opportunity to ask us questions. So just a short background. We are representatives from Roseman University of Health Sciences. We have a campus here in the Henderson, Las Vegas area. And we also have a sister university or sister location at South Jordan campus. We are a private, non-profit university consisting of colleges of dental medicine, nursing, pharmacy, and business administration. If you'd like more information about Roseman, we do have our website down below at roseman.edu. So KS M.E.R, or M.E.R, we are a student organization here in Henderson campus, but also in the South Jordan, Utah campus. We promote awareness and education about essential role of Spanish-speaking health professionals. We provide our members with cultural and language tools to bridge into the Latino community. Spanish fluency is not a requirement to join M.E.R. And some of the events that we offer throughout the year, some of them are talleres de español, where we teach commonly used phrases and Spanish terms to our students. We like to host community outreach events like the ones we have tonight. And then we also like to host some health fairs, as you can see in this picture that we had prior to COVID, where we go into supermarkets and teach the community about health awareness, checking blood pressure, and also some disease state management. So tonight we are joined by our wonderful panelists who, despite their busy schedules, they made time to be part of our event. We have Dr. Susan Yuen, clinical pharmacist at Volunteers in Medicine of Southern Nevada. She is also a faculty professor at Roseman University and director for interprofessional education. We have Dr. Ravi Soni, clinical pharmacist at North Vista Hospital, and also a Roseman University alum. We have Ms. Victoria Payne, PharmD and MBA candidate, class of 2022, and our M.E.R president. We have Ms. Yelena Jovanovic, PharmD candidate, class of 2022 at the Henderson campus, and me, Carissa, PharmD candidate 2022, and your event coordinator for tonight. So why are we having this event, right? Well, as a fun fact, October is American Pharmacists Month. The NIH, or National Institute of Health, defines a pharmacist as a health professional who has special training in preparing, dispensing prescription drugs, and providing OTC recommendations to the community, and are taught on how drugs work, how to use them, and their side effects. In 2004, the APHA, or American Pharmacists Association, established the month of October as American Pharmacists Month to celebrate pharmacists around the world and to recognize their contributions in healthcare. So although we'll be going over some popular or most common pharmacy professions, we have a plethora of specialty that exists in pharmacy. We'll briefly go over the most familiar fields of pharmacy tonight, but again, there are diverse specializations where pharmacists can practice. To start off the event, we'll go over with community pharmacy, specifically in retail setting. So as a community pharmacist, there are a lot of common roles and responsibilities that exist. If you're unfamiliar with community pharmacists, these are the ones that we often see in retail chains like Walgreens, CVS, Smith's, etc. So as a community pharmacist, when a script comes in, we verify new prescription and ensure patient safety. If this is something that they can have, depending on their allergies or their current medications. If there's any drug-to-drug interactions or even drug-to-food interactions. To resolve or adjudicate any insurance issues and promote cost-effective management. Sometimes it might be cheaper for our patients to get a 90-day supplies instead of a 30-day that they have to come in more often. They also do a lot of medication therapy management and adherence check. For example, yesterday was my rotation and I did a couple of MTM. That's what we would like to refer to, MTM management or medication therapy management. I like to go over with my patient, hey, you're taking this medication. Do you know what you're taking it for? How are you taking it? Are you consistently taking the medication as instructed by your provider? We also counsel on medication use and administration, especially if it's a first-time fill for a lot of our patients. For example, antibiotics, taking it regularly with water and plenty of food at the same time, and also finishing the course of antibiotics even if they do feel better. We address patients' concern, any side effects or allergies or barriers to adherence. We can see if a patient is picking up regularly their 30-day supply, if they're coming in on time for their next fill, and asking them, hey, are you having any issues with this medication? Why are we not consistent with it? And then addressing those concerns and maybe making it more accessible for our students. Provide OTC recommendations. Again, pharmacists or community pharmacists are one of the most accessible healthcare professional. You don't need an insurance to see a pharmacist, and oftentimes we are in a lot of the big chains that we have in the community. So we like to make, we can provide OTC recommendations to our patients. Vaccine administration and scheduling, especially now with the flu season, we administer a lot of the flu vaccines to our elderly adults and also anyone else below that. Scheduling, that's mostly about if they're 60, like for example, if they're 65 and older, are they due for their pneumonia vaccine, for their shingles vaccine, and making that recommendation for our patients. Lastly, purchasing and inventory management. A lot of our pharmacists are also pharmacy managers, so they are responsible for making sure that we have enough of the medications in stock for our patients who are currently or mostly filling these medications, and keeping in track of expiration dates that we might have or any recalls that we might have. And lastly, there's so many more. There's pharmacists in division who works closely in managing different chains in pharmacy, or they can go more into clinical setting where they do a lot more MTMs. So how do you become a community pharmacist? Well, just like any other pharmacist, there's education and training requirements. You have to earn or graduate with your Doctor of Pharmacy degree, or what we refer to as a PharmD degree. But prior to that, you have to have a completion of undergraduate requirements prior to admissions. This depends on school that you're trying to apply in. Any prerequisites can vary, just like if you need as much biochemistry or if you need a PCAT scores upon admission. And then in your Doctor of Pharmacy or PharmD degree experience, that's a 3-year or 4-year program, depending on the school, consisting of didactic and experiential learning. So experiential learning is what we refer to as our rotations, where we have to achieve a certain amount of hours to earn our Doctor of Pharmacy degree. Lastly, we do have 2 board exams that we have to complete and pass. We have the North American Pharmacist Licensure exam, or the NAPLEX, where we are assessed on our clinical knowledge. And then we have the law exam, or the MPJE, and we are assessed on our knowledge of law. And then as an option for students or graduates, they can go into residency, or what we call postgraduate year, PGY1, PGY12, in community-based management or administration, whichever one you would want to specialize in, or if you would like to teach as well. Right, I will hand off the presentation to Dr. Susan Nguyen to go over the ambulatory care.
2015. So this program is basically, the mission statement is to provide patient-centered care alongside in a professional team to increase our patients' chronic disease state and medication knowledge, to help promote medication adherence, and self-management to improve their health outcomes. So I see my role at this clinic as really being one that motivates patients and gets them to understand why they're on the medications that they're taking and help them be a part of the process in making those medication-related decisions. And it's super rewarding to see patients when they get to those goals regarding their labs, and being a part of that is just an amazing feeling. So what we do at Ask a Pharmacist at the Volunteers in Medicine is we provide patient care services. So we get individualized patient appointments where we review medications with patients. We make sure that they're on the appropriate medications for their disease states, make sure they're not having any interactions with their medications or side effects with those medications. We recommend lifestyle modifications, so that includes nutrition and lifestyle modification and exercise as well. We collaborate with the team that's there to help make recommendations to improve and optimize a patient's care. And then we also work closely with the medical team in answering drug information questions from all of the providers that are at that site. And as I mentioned before, I'm also using that site as where I train student pharmacists. So it's a really good learning opportunity to see patients and working in a free clinic where you're engaged with underserved patients who don't have access to the insurance and medical services and medicines that we're all so used to. It's really an eye-opening experience for the students. And so during my rotation, students get an opportunity to practice their skills in communication, writing up SOAP notes and writing up documentation of patient encounters. They get to apply the things that they're learning in the classroom to real patients and seeing the similarities that, and the differences that it takes to have patient care. Understanding cultural competency. My patient population, 90% of my patients speak Spanish, and I've had to learn Spanish in order to help assist my patients. And learning with the Spanish-speaking population, there's so many different cultures, right? So I get to know now what the difference is between a Cuban versus a El Salvadorian versus a Puerto Rican. The intricacies of that culture is really eye-opening. And then also understanding the importance of working with the medical team and how we can all contribute and work on the same page to help improve patient care. So if this is something that really interests you, I definitely encourage you to do your research. Some of the ways or the pathways to get to where I'm at include obviously completing your PharmD education. So going over what Carissa had mentioned earlier, and passing your board exams, of course. And then typically to become an ambulatory care pharmacist, you need to complete a 1 or 2 year residency, which is similar to, I guess, what medical residents go through. And so there is a process in which you apply for that. And then you are matched into different programs around the country. And if you're selected, you spend a year or 2 years at that site. Really, you're a registered pharmacist, right? But you're spending that time frame getting a lot of hands-on training. And so that is definitely usually a requirement of an ambulatory care pharmacist. So if this is a career pathway that's interesting to you, I would definitely encourage you to utilize some of the resources that are here. I mean, you can definitely just Google ambulatory care pharmacist, but these are the resources I think that are really detailed and really help students learn more about my profession. And as always, my email address is located here. So if you want any more information, feel free to email me and I'm happy to answer your questions. And for those that are from UNLV that emailed me to volunteer at Volunteers in Medicine previously, I did forward all of your emails on to the volunteer coordinator. And so now it's my pleasure to introduce Dr. Ravi Soni. He is actually one of my previous students. So how exciting is that to see my student out in action and now a pharmacist. And so I'm very pleased to be introducing him next.
Thank you, Dr. Nguyen. Although she insists that I call her Susan now and not Dr. Nguyen, she thinks we're colleagues now, but I still feel like I'm her student. Thank you for the wonderful introduction. Thank you for the wonderful presentation too. So my name is Ravi Soni. I'm a PharmD. I did graduate from Roseman University. I'm a clinical pharmacist currently at North Vista Hospital, and I work in the role of an antimicrobial steward. I'll tell you a little bit more about that later, but let me just start by saying that I'm just really, really, really happy that the students from CSN and UNLV and even UNR are able to join this presentation. And it touches my heart because I'm an ex-CSN, ex-UNLV student as well. So my journey was first I went to CSN, and then I went to UNLV, and now I've graduated from Roseman University. Also, it's an honor to be able to speak at the same podium with Dr. Wen. I am going to gloss over a lot of the things that she's already mentioned in terms of the technicalities of the, oh, hold on one second. Someone's telling me that my volume's not coming in okay. Is everybody able to hear me okay? Or can someone confirm?
Yes, I can hear you.
Oh, wonderful, thank you. So I'm going to not go into too much into the details of what a clinical pharmacist is supposed to do. I will give you a little bit of background on the hospital side of the clinical pharmacy. First of all, let's take a step back. So when we usually think about a pharmacist, we think of them as a person who is at a CVS or Walgreens or Walmart, dealing with patients, having the fantastic one-on-one interactions, helping them for over-the-counter medication needs or their chronic medication needs. But in recent years, there definitely has been a shift towards pharmacists entering into the hospital field. And when we start talking about hospital field, we want to keep two things in mind: the inpatient versus the outpatient pharmacy setting within the hospital. Now, what does this mean? The outpatient pharmacy inside of a hospital is much like a CVS or Walgreens. You have a pharmacist who is going to fill chronic or acute prescription medications for a lot of the patients who are getting discharged from the hospital. But then there's the inpatient hospital pharmacy, which has a bit of a different role. They, or the pharmacists working inside the inpatient pharmacy, manage the flow of the medications, because when a patient ends up in the hospital, he or she isn't going to take medications themselves. The nurses administer them. So what the hospital pharmacist does is actually make sure that the flow of the medication is maintained, that it goes properly to the nurses, who in turn then give it to the patients. And a clinical pharmacist in a hospital setting really helps out with this process and a lot more. The clinical pharmacist also goes, like Dr. Wen mentioned, on rounds, which is basically visiting the patients daily along with the medical team. So for instance, there are interprofessional teams made up of nurse, physician assistants, doctors, pharmacists, dietitians, and all of these work together in a collaborative team and manage the patient's care in the best way possible. Now, there's quite a few different specialties in which a person could be a clinical pharmacist. For example, you could be an infectious disease specialist. You could be a cardiology clinical pharmacist. You could be an ambulatory specialist as well. What I do at North Vista is antimicrobial stewardship. And antimicrobial stewardship is more or less a hybrid between an ID specialist and a manager. The manager more specifically of antibiotics utilization at the hospital. What I do on a daily basis is open up my daily antibiotics list, look at all the antibiotics that are getting used at the hospital, and then determine whether or not we need to make an intervention and tell the providers that, hey, this antibiotic's been used for the last 3 days, but now we have a culture which allows us to more specifically target the bug that is making a patient ill. So then we do a lot of those techniques where we intervene, we help out the other specialists at the hospital, just manage the antimicrobials better. At the end of the day, we get a lot of data in terms of, hey, what exactly did we do? Are we making an impact? So we collect and gather all the data, we report it to the national and state and even the hospital agencies. And at the end of the month and at the end of the year, we have a lot of reports where we see whether or not our interventions or our stewardship of this whole antibiotics utilization is having any benefit to the patient population at the hospital. So it's not exactly an ID consult or an ID specialist position, which is where the ID specialist will help the providers make the best decisions for which antibiotic to use. We do that, of course we do that, but in addition, we also manage how and when and how often and for how long antibiotics are getting used. So it's sort of an administrative and a clinical hybrid position. Okay, so let's talk a little bit about how you can end up in a hospital pharmacy position. Dr. Wen mentioned just a while ago that the best pathway to that is a residency, and that is true. I will say that myself. Not having done a residency, I will tell you that the first couple of years are going to be quite difficult in adjusting to a hospital mindset. We do not get I would say, as much firsthand exposure to the things that happen inside a hospital pharmacy as students, simply because of state laws that do not quite allow us to practice or approve orders that a regular pharmacist would be able to. So when you get that residency, you actually have a PharmD to your name and you can practice all the things that are required to do in a hospital pharmacy. But a lot of people like me are not able to do a residency, and that's okay. What a residency is simply a way to enhance your on-the-field training. But some hospitals or some other institutions may be willing to take on you on a per diem position. And a per diem means you may not work full time over there, but every once in a while, say 2 times a week, 2 times a month, 3 times a month, you get to work in that setting alongside all the other pharmacists and eventually work your way up where you can convert your position to a full-time position. It might take time, so do not worry about that. But I will tell you that if residency is an option, that if you can spare a year or two after your PharmD degree, please do that, because it is going to be very invaluable if you ever want to practice in a clinical position. The other way to get inside a clinical pharmacy setting is via your rotations, and that's actually my story. So I was a student at North Vista Hospital initially, and I was very fascinated by how the whole management of medications worked there. So after a while, after I think about 4 or 5 weeks, I asked my director, who was also my preceptor or teacher at North Vista Hospital, about how I could potentially keep getting exposed to everything that happens at the hospital. And then my director said, well, why don't you come and volunteer? We could sure use some help on the side. So I kept in touch with them even after my rotations were over. By the end of the school year, which was my final year of pharmacy, my director said, hey, you have been working on quite a lot of projects, and one of them has been antimicrobial stewardship. You have developed a roadmap to that. Would you like to continue doing that after graduation? And that was it. I did not have a residency, but I did have enough experience because I put the time in with rotations and volunteering. And that actually is the story of a lot of other classmates of mine as well. So if you don't have a residency, don't despair. There's certainly a way to getting into hospital settings as well. What I will tell you, though, is you must develop an aptitude for clinical work. And you will only find that out after you've done a few hospital rotations. You'll go in there, you'll find out whether or not you really like how you get to interact with the patients, how you can talk with the other members of the medical care team. And if that is for you, then definitely pursue a hospital pharmacist or clinical pharmacy pathway after graduation. Okay, so I have a couple of things I want to tell you, and these are tips for success, not just for after you've graduated and after you've landed your job, but even right now. Whatever you're doing in life, just make sure you know your resources, because we never truly stop learning, right? We don't always know everything. And so what's going to happen is, more often than not, we're going to have to tell someone, hey, you have a great question for me. Unfortunately, I don't know the answer, and I need to consult my resource and I'll get back to you. So know your books, know your textbooks, know your journals, know your people that you know, whom you can go to, whom you can look up to, and who can guide you through your path as you grow and learn throughout your clinical pharmacy career. Last things here, do not forget that even after you graduate, you're still going to be a student. A lot of the people seem to think, and it's quite unfortunate, but they seem to think that once you have graduated, once you get your degree at the end of your name, that means you have learned everything you possibly could, and that's simply not true. In fact, you will find out very soon after you graduate that you just touched the surface of the ocean when you were in school and when you graduated. The deeper knowledge only comes as you practice on the field. So just keep in mind that you always keep a learner mindset. The learning is never going to end. I'm more than happy to take questions about this at the end. I think we have some time allotted for questions, so I will definitely take some questions then. But if you want to contact me outside of this presentation, feel free to either text me, call me, or send me an email of the information that you're seeing on the screen. And once again, thank you, M.E.R or Movimiento and Roseman, to do this for everybody's benefit. I'm just blown away by how we're still able to come together despite all the pandemic restrictions. Thank you.
Thank you, Dr. Sodhi. That was a really great presentation. And also, Dr. Nguyen, thank you for Ambulatory. Right now, I will hand off the presentation to Dr. Nguyen to go over a wonderful opportunity for students called the CVS Pathway.
Hi everyone again. So I wanted to just introduce to you, if you don't already know, about Roseman's CBS Health Spanish Pathway Program. So this program really started from a passion that is of mine, as well as Dr. Park, who is the Director of Admissions and Student Affairs. And so in my practice that I mentioned before, I see a lot of Spanish-speaking patients, right? And, you know, in the classroom setting, being a professor, not seeing as many Spanish-speaking students, right? And how do we bridge that gap? Because we know our population is getting more diverse, and we know there's going to be many more Hispanic, Latino members of the community. And so how do we encourage and support and elevate that group of people to become maybe considered profession of pharmacy, so that, you know, when you go to your local pharmacy, you have people that are there that represent you, right? And who know you and know your culture, right? So that is really the mission of this CBS Health Spanish Pathway Program. And so what Dr. Park and I did was we wrote for a grant to help support our mission in supporting, elevating the Spanish speaking community. And so we were awarded that grant many years ago. And so luckily, because our program is doing so well, they were able to extend our grant money. But anyways, this grant, what this has allowed us to do is start the CBS Health Spanish Pathway Program. And so if you are admitted into Roseman University PharmD program and you have an interest in joining this program, you don't need to be a native speaker, but we do ask that you have some basic fluency in Spanish. What we will do is that you will apply, and basically the rewards of this program is if you are selected, you will get placed at a CVS Health pharmacy in a Spanish-speaking dominant community, and you will get to practice and be able to utilize the information you're learning in the classroom and being able to interact with Spanish-speaking patients. How great is that, an opportunity for you to do that? And then, so you'll get a lot of your experiences at the CVS Health pharmacies in those communities. In addition to that, you will also be able to get a paid internship through CVS Health. You'll also get opportunities to network with their executive members. So not only their local executives, but on a national level, some of the people that make the most important decisions for CVS Health, you'll get to interact with them. You also get an opportunity to get a scholarship, as well as free membership into our M.E.R program. And also a free, one of the really cool things is is a certification course in medical Spanish that you will get to complete. And so I did that myself, and I thought it was an amazing course, and being able to have access to that as a student is only going to help you with your career going forward. So those are the kind of the benefits of the CVS Health Spanish Pathway Program. So again, if this sounds really interesting to you, you want to learn more information about it, please visit our website that's located here, or feel free to email that email address or email myself. Happy to share more information with you, but it is required that you are a PharmD student, and typically you apply for this program at the very beginning of your first year, right after orientation, and then we kind of continue on for the 3 years within this program. And if things go well, the ultimate goal is for you to get a job within CVS Health at a Spanish speaking dominant area, or in a pharmacy in a Spanish speaking dominant area. So that is the overall goal of this program. So happy to answer more questions about it when we get to our Q&A.
Thank you, Dr. Nguyen. And like what was mentioned, we will have now our time for our panel discussion. So again, we have Dr. Nguyen, Dr. Soni, Ms. Victoria, Ms. Yelena, and myself. I will start off with, or you can start typing your questions in the chat, or you can unmute yourself if you'd like to speak later on. I'll start off with a couple of questions here to get the ball rolling. So to give you time to type in your questions. So for our student panelists, we have plenty of pre-professional students and even high school students tonight in the audience. What are some advice that you can give them about preparing for grad school or professional school?
I believe that question is for me, right?
Mm-hmm.
So I would definitely say to pay attention to biology, as in biochemistry. Try to remember what our body does with chemical compounds or classes of chemical entities in terms of metabolism. So fats, carbs, stuff like that, enzymes. Try to put an accent on anatomy, physiology. That plays a big role in pharmacy school too. And other things like calculations are critical. And for someone like me who's language, primary language is not English, it was also important to get proficient in English, right? In reading, writing, communication too, being able to speak publicly and just communicate with all different levels of education and people to get more comfortable with patients and other professionals.
Thank you. That was so nice, Elena.
Can I also add something in as well?
Oh, yeah, please.
Okay. Another piece of advice I would have for you all too is really try to get some pharmacy related experience. You know, pharmacy school is not a inexpensive venture. So you want to make sure that pharmacy is right for you. So really do that research. If you have an opportunity to shadow pharmacists or even work as a technician, that would be a great experience. Just make sure that this is really the right pathway for you.
Thank you. Victoria, did you want to add on to that advice?
Yeah, so just to add on to that, you guys seem like you already are very involved with school. So just getting involved with the community, student organizations at your universities or colleges, just so that you can find out more information about the specific programs that you are interested in. And yeah, just to get more involved with resource, gets more experience, just so that you know this is what is right for you.
Thank you. Did someone wanted to ask a question in the, let's see. Are we able to join M.E.R if we're already part of a professional fraternity? Of course, M.E.R is an organization, student organization on campus, and it's totally exclusive out of professional fraternities, so you're definitely welcome to participate in. We have some students, our Roseman students, adding in some advice, so those are really great to check out as well. We have some U.N.R alum. That's so great. Aw. Okay. Oh, I have a private chat here. So there's a question, I guess this is mostly for our clinical pharmacist. It says, do you have to do a residency at the place that you would like to work at?
So that answer is definitely no. So like Dr. Soni mentioned, it's not necessary that you do a residency to get a clinical pharmacy position, but it is a harder path to be able to get to that position. And so realizing that Dr. Soni, when he was a student, is a very self-motivated student, right? He did really extremely well in his rotations, and pharmacy is truly a small world. There are times where I get calls from students who graduated 5 years ago asking me for a letter of recommendation. You know, you just never know when someone that you interact with might become your boss, right? So he was very self-motivated and was an excellent student. And so it was an easier way for him to get to network and then also to be able to be offered that position. But when you do a residency, it doesn't matter necessarily where you do that residency at. So we had mentioned a 1 year into your residency. The first year of residency is usually pretty generic. You get to see lots of different aspects of a hospital pharmacy. And usually in a second year, that's where if you would like to continue with the second year, you would specialize in like what Dr. Soni mentioned in infectious disease or cardiology or so on and so forth, right? After you complete the residency, though, that's where you apply for positions, and you can apply for positions wherever you want in the United States, right? So you don't have to, sometimes those hospital systems, if you like them and they like you, they'll give you the opportunity to work for them after residency, but you can apply to work at any position. So sometimes I know that residencies are becoming more and more competitive, and students really want to all go for a certain residency or a certain program. But at the end of the day, the most important thing is having that residency to gain that experience. It's like a piece of paper, like a slip of paper, right? That you have in your hand that you're able to then apply for these positions that are typically not open for people that don't complete residencies.
Thank you.
And just quickly add on to that, Dr. Mill, thank you for sharing that. What I have also noticed is whether or not you end up getting a job at the place you did your residency also depends on how the turnover at that particular facility is. So there are some facilities where you'll have pharmacists who've been there for 15, 20 years, and there's not a lot of turnover. And there's other places where you do have a high turnover. Pharmacists come and go every 3 or 4 years. So when you're seeking out residencies, I would recommend that you also look at some other factors that may help you determine whether or not you want to really do a residency at that place and then try for a job over there, and what your chances are going to be depending on the turnover.
And I just wanted to also comment on the number of residencies. So I started at Roseman this is my 8th year teaching at Roseman. And when I first started, there were only pharmacy residency positions at UMC, locally here in Nevada, as well as the VA system here for ambulatory care pharmacists. And since that time, we've had so many new opportunities for students to complete a residency. So Mountain View now has 8 positions, Valley Hospital has 2 positions, St. Rose has 2 positions, UMC and the VA still have their positions. So it's really exponentially increased since starting at Roseman, and it's really great to see that the role of clinical pharmacists and residency trained pharmacists in the community. But again, realizing that there's opportunities for that. If you're a self-motivated individual and taking the route that Dr. Soni has, I mean, that's a really great thing that he was able to do.
Thank you. We have more private chats here. As where should we look into if we want to learn more about different pharmacy specialties?
So, and Dr. Soni, do you want to go first, or do you want me to go?
You can go, Dr. Lee.
So there's a program, if you guys just Google APHA Pharmacy Career Pathways. And this is like an assessment that you do. And basically you answer some questions and it tells you, hey, what would you like to enjoy in your future career? Like what aspects? Do you enjoy working with patients? Do you enjoy working with the medical team? Do you like having a career where you kind of do the same tasks every day? Do you like something different every day, right? And what happens is after you do that assessment, it kind of gives you another web page where you can read all of the different career pathways that are out there in pharmacy. And it kind of shows you, based on what your preferences are, what matches well with your characteristics. And so let me actually look that up for you, and I can put it in the chat function, because I always recommend to my mentees this if you're still kind of exploring what you want to do.
And I've also posted another link in the chat. Dr. Wynn, sorry, I don't know if you were going after the same one or not, but bpsweb.org is also going to give you quite a bit of information about different board specialties.
Yep, they're all in the chat. If you guys want to click on those direct links. And then we have a question for Dr. Soni. What do you find is the most rewarding and challenging in antimicrobial stewardship? And I guess as well to Dr. Nguyen, what do you find most rewarding and challenging in ambulatory care?
The most challenging aspect of antimicrobial stewardship is delegating the tasks to the rest of the team. And it is challenging from a technical standpoint, because the way in which our pharmacy at my particular hospital works is that we have different shifts of work that correspond to the different towers or different units that we have at the hospital. So for instance, the morning shift will look at towers 1 and 2, the evening shift will look at the ER and the ICU. And so when the role of the antimicrobial steward is really to monitor all the patients hospital-wide every day, coordinating how all of that information from the different shifts gets communicated to you can really be very challenging. And sometimes you do miss patients, in which case I have to go in and do the work myself, which is completely fine. However, anything that is delegated then does not get completed at the end of the day. So technically speaking, the delegation of tasks, just because how we operate our different shifts, is very challenging. The most rewarding, I would say, so it's a very personal thing, right? Because we got into clinical pharmacy because we wanted to help patients, but also because we wanted to kind of, I guess, prove to ourselves that we're specialists. We know our drugs. So when a provider asks you for a consult, hey, this patient has XYZ bug and at this particular site on their body, what do you recommend? And being able to recommend that drug, I think, and the provider listening to you and actually putting in an order for the medication, that's just a very, very good feeling.
Yeah, those are really good points. I would say my most rewarding thing is working with patients and seeing them when they have these chronic disease states. Like, for example, they have diabetes. I just had a patient recently that had an A1C of 14%, which is a measure of your blood sugar over the last 3 months. And typically our goal for our patients is to be below 7%. And so this patient was double their goal, right? And so I've been able to work with them over the last year or so, and them getting to be able to be less than 7%. And that's super rewarding to be able to know that I helped to contribute to that success was really rewarding. Some of the challenging things is kind of on the reverse is, you know, sometimes you work with these patients, and I'm working in a free clinic setting where, you know, patients don't have access to, they don't have insurance or access to a lot of medications. And so it's really challenging and sad to kind of see the health disparities that exist in our community, and how, you know, just because of your background, you might not have access to things that people do if they have other backgrounds. And so I think that's one of the hardest things to see. But I think it's also a good learning experience for students to know that, you know, just because you learn a medication in pharmacy school doesn't mean everyone is going to be able to have access to that. And what do you do for those patients? And how do you make sure that they're still getting the best care possible without maybe getting that one medication?
Thank you, Dr. Nguyen. I guess this goes into the other question that we have for you. How many patients do you typically see per day at the clinic?
Yeah, that's a good question. So my rotation, and Dr. Soni can comment too, because I didn't have him as my rotation student, but he was with my colleague, Dr. Okolo. So we kind of interacted some together when he was on rotation. But anyways, the purpose of my rotation is really an educational rotation. So if you were going to get a rotation in ambulatory care pharmacist who wasn't a faculty member, you know, they would probably see between, I don't know, 6 to 10 patients a day. You know, and you would follow with them, and they would help you through and understanding how to interact with this patient, right? But for my rotation, I really try to ensure that we're not just seeing patients and you're not just acting like a robot. I really want to make sure that when you say something to me and you recommend something, you really understand the background of why you're saying the things that you're saying, and so that you become more confident and competent as a student pharmacist and then going on to a practitioner. So as an academic pharmacist, I typically see between 5 to 6 patients. So I definitely see less than what a typical ambulatory care pharmacist is, because again, my role is primarily the educator to educate the students. So.
On the antimicrobial side, I would say that we see somewhere about 40 to 50 patients a day. But when I say we see patients, I don't mean we actually go and visit the patients. We mostly monitor their charts. And for about 6 to 10 of them that require special infectious disease consult or any other questions that the providers may have of us, we would help out with that as well. So I typically would work up about 40 to 45 patients a day. And I would consult for 5 to 10 patients per day.
Thank you. And I have another question here. Did any of you know what field you wanted to work in during your P1 year? A great question, Ms. Bell.
That's a fantastic question. And then the answer is a straight up no. I had no idea. I did not even know actually in P1 that there were clinical pharmacists out there, because you know, again, I got into pharmacy with the only experience of my cousins who are retail pharmacists, and I really did not know anything about the world beyond retail pharmacy. I, in fact, didn't even know in P2 what I wanted to do. It was block 2.9. So I suppose about either December or January when we had our antibiotics class, and antimicrobial stewardship was a one slide mention in one of our classes. And it just, piqued my interest. And when I went into my rotations, when my director asked me, what do you want to do? I said, well, antimicrobial stewardship, because it just seems like nobody's doing it. And so I want to jump into it. And that sort of in the future led to me developing the roadmap at my hospital. But I wouldn't say I even knew, even in the, at the halfway point of my final year, what I wanted to do. I just found out about it after my director hired me, and I'm like, okay, I think this is what I'm going to be doing.
Yeah, I did. I went to a 4-year pharmacy school, so that's different from Roseman, which is a 3-year program. But I was a technician at Walgreens for quite a number of years before I joined pharmacy school. And then I worked there as an intern, and I worked at Walgreens at a point when they were actually giving you scholarships to work for the companies after you graduate. And so it was a different time than what it is now. But I actually I took that scholarship, and so I kind of committed myself to work for Walgreens after graduation. But during my 3rd year of pharmacy school, I was introduced to ambulatory care and got to shadow one of the faculty members at Ohio State, and just really saw, like, I was super passionate about it, and I just really saw myself doing it, and then decided to kind of go the route of pursuing residency. And so I had to pay back my scholarship monies to Walgreens, and they completely understood my decision. But I definitely didn't know for 3+ years that I wanted to do that. And again, with pharmacy school, like, you just don't have a lot of exposure until you get that exposure, right? So it's kind of like you have to come to these events. You get to learn something new every time and learn from these different speakers. And then it's like you do your own research, right? And that's how you learn about it. So unfortunately, we just don't have a lot of opportunities for you to experience things hands-on while you're in pharmacy school. But let you know that everyone that's probably where they're at didn't know. And even when you graduate, the saying goes that your job is going to change 4 or 5 different times after you graduate. So.
Thank you.
Dr. Wen mentioned something that's a very, very important point. So I just want to stress on that again, is that do your research. Just because we didn't know, and I think I can speak for Dr. Wen too, just because we may not have known for a while where we wanted to go, it didn't mean that we weren't doing our research or that we weren't inquiring about what exactly is out there in the field of pharmacy. For instance, there's a lot of bioinformatics, there's data analytics, data science is actually becoming big in healthcare in general. So as you go through your P1 and P2, don't stop researching. And this again kind of goes back to what I said on my penultimate slide, and that don't stop learning. You're always learning, always inquiring, always being curious. And I think just knowing that there's more, you'll expose yourself to more opportunities.
Thank you, Dr. Nguyen and Dr. Soni. I have a really great question here for the students. It seems like you have to do a lot of things to stand out and do residency and get a job after. How do you handle all of these responsibilities?
I think I'll go on that one. I learned, and then this is going to be very counterintuitive to many of you, and I really don't hope to inject depression into anybody right now. But one of my preceptors told me at one point that life is arbitrary. You could have played all your cards right, but you still may not get what you started pursuing. And that's okay. The best thing to do is just know that you want to do it and then give it your best effort. What happens afterwards, not in our hands, but the effort portion is definitely in our hands. And so as long as you keep networking with people, as long as you keep putting your best foot forward, as long as you show others that, hey, look, this field of pharmacy or what I'm doing today means something to me, it's going to exude. People are going to see that. And a lot of the times getting a job is a matter of what you're able to project onto your preceptors, onto your employers.
And I would echo what Dr. Soni is saying as well, is that don't think of it as things that you're doing, but think of it as experience you're gaining. When you are doing research, when you are a part of student organizations, you are doing public speaking, you are showing how effective you are at multitasking. your leadership skills, your ability to critically think and doing research, right? And so when you apply for these residency programs and they see this history of all the things that you're doing, it's not about the number of things, but it's about the experience you gained while doing those things, right? So it shows you when you apply to these residencies, hey, this student is really good at managing all of their tasks. They're able to effectively go to school and also do research and have an internship and all of these different things. And, you know, that is a good indicator for people that are trying to hire you, right? Because they don't really know you. All they know is a piece of paper with all the information of what you're doing. So don't think of it as like things that don't matter, but think of them as what experience am I going to gain from doing these things?
Just to quickly add on to that, Dr. Nguyen, thank you for bringing that up. It reminds me of my P1 year when I tried to be a part of 7 different clubs and I really didn't do a great job of any of them. So anybody who is doing that right now, I would say choose your focus, be a part of fewer clubs unless you can really handle 6 or 7 clubs or organizations at Roseman or whatever pharmacy school you're at or are going to be at. Choose your focus and do something impactful within those clubs, and that will allow you to show, just like Dr. Nguyen said, your intent.
Yeah, it's all about the quality of your experience, right? I think that's super important. Don't burn yourself out. But your resume, your CV, like read it. If I look at it, I should be able to know like exactly what your goals are, what you're trying to do, because of all of the things that you're doing lead up to that goal, right?
Thank you. It's definitely, it's not impossible if it's something that the things that you're joining in are something that you're really passionate about, things that you really want to do. Like right now, for Victoria and I, and for Yelena, we're part of M.E.R, and it's taking the time, putting in the time and the effort. It's all, if it's something that you're really passionate about, then it's all worth it. Definitely being organized about it and then prioritizing it. We have all these events, but we're students first. That's our biggest priority, right? Making the time out of that. All right. For our panelists, students, I guess our because you guys are also preceptors, Dr. Nguyen and Dr. Soni, we have P1 students in the audience, and it's their first rotation this week. What are some advice you can give them on their first week in rotation?
Let's have the students answer first.
So for the first day, I'll definitely don't be late. I'll say that. And dress professionally, casually, but be comfortable, but be professional. Be enthusiastic, I'd say. I also had no pharmacy experience at all, but I was willing to learn, willing to help, and I think that's important. It's important to ask questions when you don't know something. Make sure, be open to criticism and smile. Be empathetic with patients that you see. And as far as knowledge, maybe if you're past, and you are past law and OTC blocks, brush up on those. Yeah, you will use them for sure.
Yeah, just to add on to that, I would say don't be afraid to ask your preceptor questions because we still are students. We're not going to be able to know everything. So it's always good to ask your preceptor questions, and that can also open up room for more conversations to happen and for more opportunities for you to learn. So that would be my advice.
I would say, like, in general, going into your community pharmacy sites, know that it's super busy time of year with flu shots, right? So I think the first day, especially if you don't have a lot of experience, just introduce who you are and say, what can I do to help you guys? And so that will just help to build like trust into you as a student, that you're just willing to jump in. And then once you get settled there, I would just really encourage you, as a preceptor myself, I love it when students say, hey, you know, this is what I want to learn on this rotation. You take a proactive choice of deciding like what you want to learn, because as preceptors, we assume like you want to learn this or you want to learn that, or you're just here to help us, but we may not know exactly what you're wanting to get out of it. So just be vocal about that and be respectful, and also ask, you know, your preceptors for feedback, because you want to grow while you're there. You know, if you're filling prescriptions all day and you are upset about that, but you didn't talk to your preceptor about that, well, they don't know that you're upset about that, right? And they're going to have you continue to do those things. So I think it's just taking some time and realizing that, you know, being in charge of your education and also asking for the feedback to get better.
Yeah, I'd like to add on, someone also mentioned it in the chat. I have it with me. I don't know if you can see it because of my background, but I have a notebook that I keep with me, and I write in everything that I'm learning, how to use the computer, what are their data, how they input data, any medication that I'm not familiar with. I write it down, write notes about it, and then maybe for the next time that that patient comes in, I can counsel the next time. So definitely have that notebook, have your pen, be professional. You're gonna have some difficult patients, but like Yelena mentioned, be empathetic, right? There's a lot of reason why people might not be as friendly as you think they might be, but I like to think of it as they just waited hours at the doctor's office, or they're having insurance problems. So just be empathetic and understand where they're coming from. All right, for Dr. Soni, we have a question in the chat. Do you see a trend in the prevalence of certain types of microbial infections worth noting here in Southern Nevada? For instance, the amount of gram-positive versus gram-negative or hospital-acquired.
That's a great question. Thank you, Ryan, for that. And I'll get back to you, but I just want to thank everybody in the chat who have been pitching in also. I think it's all extremely good advice. I want to point out something that Melissa said and Louis said as well. Really, really salient pieces that everybody should probably read once if you get a chance in the chat. So number one, don't try to show to your preceptors what you're not. They will catch on to that really quickly. Number two, show that you're proactive, like Dr. Wen said. So like Melissa is also pointing out here, don't just stand there. If you can jump in on something, definitely jump in. If you don't know, ask, hey, do you have a little bit of time to explain this to me? And then maybe I can continue to help out with this over the next few weeks that I'm going to be here. Keep looking for tasks. I have heard a lot of students tell me, but I don't know what to do. Like I can't find things to do. And I guess sometimes it's true, but for the most part, it's not true. There's always something to do. So just look around, keep your eyes open, keep your ears peeled. And if you can find something to do, then absolutely jump on it. And finally, the one thing that I've noticed preceptors enjoy a lot, and they won't maybe even mention this to you, but they will notice this. If they ask you a question, and even if they don't mean for there to be any kind of follow-up to that question, have a follow-up. So let's suppose they ask you a question XYZ today, you don't know the answer. They don't ask you to follow up, but get an answer when you go home that night. And the next day tell them, hey, I looked this up and here's the answer. You will impress them. I will guarantee you that. Now to come to Ryan's question, Ryan, nothing that you don't already see in other parts of the country. I think we do see quite a little bit more of the gram negatives nowadays. I don't know if you've heard of this, but Acinetobacter and Pseudomonas are two of the more concerning infections that we're getting, and we're getting them to be multi-drug resistant as well. So it's difficult to treat those patients getting Acinetobacter and Pseudomonas.
Thank you so much. You guys have really, really great questions, and I'm so glad you're taking this opportunity to ask and learn more, especially for our undergrad students and also our P1s who came in tonight. We are on our time constraint, so I will pass it on, to our M.E.R president.
Thanks, Carissa. So we just wanted to thank you all for joining us tonight. We really appreciate you guys being here and asking all these great questions and letting us have the opportunity to speak to you guys about pharmacy. So as a reward, we are just going to do a random raffle for a gift card of your choice. So our winner of this raffle is Harminder Kaur. I'm sorry if I butchered your name, but so you are our raffle winner for our session today. So if you can email me your email address and yeah, and we'll be in touch. Congratulations.
Right. Thank you so much. Congrats, girl. Raffle winner. We just have a small request before we conclude this event. If you guys are comfortable and okay with it, if you can have your video on so we can take a group picture. Ah, yes, I see you guys' videos. Thank you. Oh my God, I love you guys' backgrounds. Brian, your background of Halloween is very on point. I love that. Also, Sydney, I love that background. Thank you, guys. Thank you. Yes. All right, I'll give you guys a minute to turn on your videos. You guys have really creative backgrounds. Mine is so plain. All right. You guys can just smile for like, just try to hold it for a minute, okay? I'm gonna try to do this. All right, 1, 2, 3. Next slide. 1, 2, 3. Great job. There's 100 of you guys. 1, 2, 3. Nice. And last 1, 2, 3. Thank you. Thank you, guys. I will steal some of your backgrounds for class tomorrow.
I just want to thank everyone one more time, and Dr. Nguyen, it was a pleasure being able to share the same stage with you. I think I'm just honored that I have the opportunity to set aside my preceptor from the past. And thank you, M.E.R, so much for doing this. I think it's just great to see so many people participate.
Thank you, Dr. Soni, for your gracious words, and happy to have you on anytime. Thank you for your wisdom.
All right, for our Roseman students, we do have the QR code and the short link here for your CPD credit. You can fill them out. Thank you to our South Jordan campus. Wow. Thanks, guys.
Oh, and I'd also like to give a shout out to Ms. Brenda Griego. She is the Director of Alumni Affairs, and so she was able to connect us with Dr. Soni for this event. So we'd just like to give her a big thank you for putting this together with us.